What's up guys, it's been a while since my last video. What can I say, it's been a very busy 2022. The wife and I have been trying to save up for something really important, and you might as well have heard of the energy crisis, the inflation, and of course the new Prime Minister. Yay! So a lot of you must have been contemplating on this very important question. Is it still worth it to come to the UK and work as a nurse, especially for the NHS? And my short answer is yes. And here are my 5 reasons why it's still worth it. Number 1, among the many European and Western countries, the UK still has one of the easiest pathways towards citizenship. So this is very important if you want to become a citizen of Europe, or if you are after a stronger passport. For Filipinos like me and those who love traveling, we know the limits of the Philippine passport and the advantage of having a Western passport when it comes to visas. Because if you have a Philippine passport, you have to, for example, if you want to have a tour within Europe, you may need to apply for a Schengen visa, which sometimes can't be easy and frankly might be expensive. Compared to when you have a British passport, you just have to, I don't know, buy a plane ticket. You don't need to apply for such visa. There's nothing wrong with living in another country. Like, you can always be patriotic or nationalistic towards the Philippines if you wanna, but there are some people who wish to have a European citizenship, and if you're one of them, then the UK is one of the easiest. So why is it easy? Simply because if you work for the NHS or if you work under a Tier 2 skilled worker visa or a healthcare visa, you only need to stay in the UK for at least 5 years before you can apply for a permanent residency or an indefinite leave to remain. And then if you want to become a citizen, you just need to stay for another 1 year, pass the Life in the UK test, and pay for a certain amount of fees. For full information, you may visit the government website regarding visas. I'm not really an expert, but that is basically the gist of the advantage of living in the UK, of working and living in the UK. Second, if you work here under a skilled worker visa or a if you work in the UK under a Tier 2 skilled worker visa or a healthcare visa, your dependents can also enjoy the benefits such as free healthcare and free education. Technically, it's not free because all employees pay for the national insurance, pay taxes, and pay the NHS pension, but it is free for your dependents because they're not paying for these benefits. You do. So if you think about it, it's still free. Well, at least for them. And you know, if you ever need to be in a hospital, admitted in a hospital, or have a surgery, you don't need to pay anything, because you've already paid for it in taxes. What I'm trying to say is, at least you can appreciate where your taxes are, unlike some other places. And speaking of education, if you want to enroll your kids in a public school or a state school, or I forgot what they call it, but let me just call it a public school because that's maybe the term that you are familiar with, then you don't have to pay for any tuition fees. Although, of course, you need to pay for certain things like your children's uniforms or the things they need for school. There's also a program for students applying for universities wherein they can apply for a loan, which they can pay for later in life or when they start earning their income. Just make sure that as soon as your dependents arrive in the UK, you have to register them in your GP practice and your dentist, especially dentists, because dental services in the UK could be a bit expensive. Take care of your teeth and gums because dental services are really expensive here. Now, third, let's talk about enhancements, so salary. Remember when you were trying to apply for a job in the NHS, you might have seen several job adverts where they put the annual salary, like for example, if you are starting as a band 5, it is 27,055 per year. But take note, this is not entirely accurate. Why? Because this annual salary that they're putting in the advertisement doesn't cover enhancements and bank shifts. When you start working for the NHS, you will receive enhancements for certain conditions. Like for example, if you work during the weekends, if you work beyond the social hours, if you work during public holidays or bank holidays. So your annual salary is actually higher than what was advertised or whatever was written in your contract. What most people tend to do is as soon as they see their contract, they will divide the annual salary with the number of months and then the number of hours within that month, and naturally they will see the number say, oh, this is not that high. Maybe it doesn't look high enough, or it doesn't look really attractive, but don't forget to add your enhancements. So just a little more information about enhancements. Remember, not all trusts offer the same enhancements, or not all trusts have the same percentage. For example, in my trust, for bank shifts, the pay differs depending on the shift that you are covering. Usually, early shifts are paid more than late shifts. Longer shifts are paid more than 8-hour shifts, and so on and so forth. So you have to clarify this with your recruiting agency before you sign that contract of agreement or contract of employment. I've forgotten what the name of the document is, but you know what I'm talking about. Another thing here in the UK, if you are from the Philippines, just remember that overtime here in the UK is well compensated. You just have to make sure that it's well documented and approved by your manager. Well, unlike back home, wherein you're punished for coming in late and then you don't get rewarded for rendering overtime. So here in the UK, we are paid for every hour that we do work. In a previous video, I shared my salary, my average salary when I was a newly qualified nurse. Naturally, so at present, I'm now paid more than that because I have done more bank shifts and have done, well, more shifts in general, more on calls actually, but I also do other shifts. My net pay now is significantly higher than what I posted before. Hint, it's almost doubled. Fourth reason why it's still worth it, especially if you're working for the NHS. So if you're starting as a band 5 with just a year or 2 years of experience, you are entitled to 27 days of annual leave plus 8 public holidays. So if you think about it, you will say, that's not really much. It's the same with Saudi Arabia or the other Middle Eastern countries. What they don't tell you is that the annual leave entitlement is actually computed in hours. So in our e-roster, we are entitled to 262.5 hours of annual leave in a year. However, remember that the standard working hours is 37.5 hours in a week, excluding the weekends. So basically, if you file for an annual leave for 7 days, they don't include the weekends in the total number of hours, which means it's still 37.5 hours, but you are on annual leave for 7 days. Did that make sense? So if we divide 262.5 divided by 37.5, that will give us about 7 weeks of annual leave. And this is for people who just started working for the NHS. The longer that you work for the NHS, the more annual leave entitlement given to you. So think about it, 7 weeks of annual leave, that is almost 2 months. But of course, you can't use your 7-week annual leave all together. It may vary from trust to trust, but in my trust, if you exceed 3 weeks of annual leave, you have to inform, or you have to get the permission of your manager. This is just to make sure that the staffing ratio in your department would still be safe. And remember that the 7 week of annual leave is in addition to the 8 public holidays. So think about it. There are a lot of vacation. There are a lot of opportunities to have rest or vacation. If you'd rather work during public holidays, you will be compensated as well, which is roughly twice your hourly rate. Can you work during your annual leave? Technically no, because you just filed for your annual leave. However, there are certain circumstances wherein you can work within the same trust. And reason number 5 why I personally think it's still worth it to come to the UK and work for the NHS is the salary. So a lot of people, when they argue about salary, they would merely look at the numbers and say, hey, the salary offered for nurses in Australia or the United States compared to the UK is significantly higher. Others would argue using cost of living, but I think a better argument is if you compare the price of the commodity or whatever you're buying versus the amount of money that you are receiving after taxes. So let's talk about rice, since most Filipinos eat rice. Like 99% of Filipinos eat rice every day. In the UK, because my wife and I love to shop in Tesco, which is the standard, which is the equivalent of SM supermarket. Am I saying it right? In Tesco, a 5-kilogram bag of basmati rice costs £8. So let's say that in a month we are buying 10 bags of this 5 kilograms basmati rice, that means we are spending 80 pounds for rice alone. So if we compare it to our monthly combined salary after taxes, which is roughly 2,500 pounds. So again, this is after taxes, after insurance, after NHS pension, the percentage is 3.2%, which is very low compared to if, for example, we are still living in the Philippines. Same situation, we are buying what, 500 kilograms of rice in a month. Each kilogram of rice, let's say, is around 70 pesos. So that means in a month we are paying 3,500 pesos for rice alone, compared to our combined monthly income after deductions, after taxes, after Pag-ibig, PhilHealth, SSS, whatever. Our average monthly income back then was 30,000. This was combined. So 3,500 divided by 30,000 pesos, that will give you 11.67%. Now tell me which is more expensive to live in, the UK or the Philippines? This also goes with other commodities. The only thing I'd say would be more costly will be transportation if you are living in the countryside, because as I've told you before in my other videos, if you live in the countryside, you may as well have to buy a car unless you're willing to walk. Public transportation in the countryside is not as ubiquitous as those in London. In London, you can take the bus, you can take the tube, but in the countryside, I can't guarantee that there will always be a bus. The advantage of places such as Yeovil is that, I don't know, most of the important places that you have to go to would be within walking distance. Like, for example, from our flat to the hospital, you can just walk. From our flat to Tesco, we walk. That is another thing that has changed ever since we moved to the UK. I've learned to walk more, because back home in the Philippines, I just drive to anywhere that I need to go. Like for example, if you need to do our groceries, if you need to go to work, if you need to go to the dentist, I drive. In the UK, everything is within walking distance. So I think we've saved significant amounts of money from walking. So those are my 5 reasons why I think it's still worth it to come to the UK and work for the NHS. If you like this video, please click like and subscribe, and visit my channel and watch my other videos. Thank you for watching, and hopefully I can upload more videos. I'll try to be more active. I'm also on TikTok, so just search for Jet from Recovery in TikTok. It's just another side of me. I will upload more skits and more videos soon. Fingers crossed. Thanks, bye bye.